Good afternoon. I'm George Latimer, Westchester County Executive. Welcome to the Village of Portchester and the Justice Court, where we are here for a press conference to outline a major initiative that the county government and local governments are working side by side to deal with those situations in police work that involve dealing with those who have mental health issues, and to try to do that in a professional, appropriate way. I'm joined by a lot of very important and very well-known people throughout the county, and I want to take a few minutes just to identify them for you. Speaking with me here behind the railing, the Commissioner of our Department of Community Mental Health, Michael Orth, the Deputy Commissioner of our Department of Public Safety, Terrence Rayner, our Commissioner of the Department of Social Services, Leonard Towns, Karen Fink, who's Vice President of Clinical Services for Family Services of Westchester, and also Chief Christopher Rosabella from the Portchester Police Department. And we're very grateful to have them all as contributors directly in this press conference. We're also joined by the Honorable Mayor of the Village of Portchester, Louis Marino, and Portchester Village Trustee Joan Grangenois Thomas is with us as well, and the Village Manager Stu Rabin is with us as well. We also have very prominent individuals throughout the room, and I want to again identify them before we get fully underway. We have with us the Mayor of the Village of Mount Kisco, the Honorable Gina Piconich. We have the Mayor of the City of Peekskill, Vivian McKenzie, with us today. We have the Town Supervisor for the Town of Ossining, Dana Levenberg. We have with us members of the Westchester County Board of Legislators, the Vice Chair of the Board of Legislators, who happens to represent this particular district, Nancy Barr. We have County Legislator Vedat Gashi. County Legislator Damon Marr is with us as well. And as others may join us, we'll be happy to recognize them so you know who's there. We have many of our top police professionals, those involved in this program from around the county. We have from the Greenburgh PD, Captain Valentine. Just raise your hand so we know where you are. We have with us Lieutenant Varkey from the Yonkers PD. We have Peekskill Chief Dalewski, pardon me. Can always get all the names right, even though we have coffee together. We have the chief from the Village of Rye Brook, Chief Austin, is with us here today. And if I have missed anybody from the professional police world, please have a note forwarded up to us so I'll make sure we recognize you. We have just been joined by Assemblyman Steve Otis, who represents this area of Westchester County. Steve, thank you for being here. We appreciate that. We have two members of the Greenburgh Town Council, Gina Jackson and Ellen Hendricks, who are here. Thank you both for being here as well. And if I have missed anybody, please just let me know, and I'm happy to introduce them. This is a cooperative program that will involve multiple numbers of communities as well as the county government, and every one of these people in the police services and in the general government are all critical partners in making this succeed. We had a rather somber anniversary yesterday, 2 years since the death of George Floyd in Minneapolis. We have had two very somber incidents happen within the last 10 days, the murders that occurred in Texas at a school shooting and the murders that occurred at the Top Supermarket in Buffalo. Both of those incidents are just the tip of an iceberg, where there are other circumstances of mass murders or even individual actions that happen in which individuals who clearly have mental health issues have taken other innocent lives because of their behavior. And we also have a challenge, and we've tried very hard to balance that challenge of appreciating the great work that our police departments do, and at the same time identifying ways to improve what that police services are. And this is one of those areas of change and reform, what we're dealing with today. The program today that we're going to talk about, and I'll let Commissioner Orth and some of the other commissioners give you greater detail, is a cooperation that fits under one of the general major recommendations that came out of our county-wide police reform task force, and it mirrored what many of the local police reform task force asked for, which is a coordinated regional approach to dealing with those incidents where mental illness may be the cutting edge of what is otherwise a police response, and to see how we can integrate a mental health professional response alongside the police response to get the best possible result, the least amount of tragedy that occurs, and there have been anecdotes along those lines. So the county has contracted and implementing now a program called Project Alliance, and we're here in the Village of Portchester because the Portchester Police Department, under the leadership of Chief Rosabella and under the general leadership of Mayor Marino and Village Manager Rabin, have embraced it and have moved quickly to implement it. And we want to talk about what that program is like in some detail. So to take us to the next step, I'm going to ask our Commissioner of the Community Mental Health Department, Michael Orth, to lay out what Project Alliance is and tends to be. And in sequence, I'll ask for other additional individuals to come and share their thoughts as well. Commissioner Orth. Thank you.
I'm truly excited to join all of you this afternoon for the formal launch of our Project Alliance Mobile Crisis Response Team, starting right here in Portchester and 6 other sites throughout Westchester County. This is truly a momentous occasion in Westchester and our local communities that we'll have a profound impact on how we address behavioral health crisis for our residents. National statistics show that 20% of police service calls are for an individual suffering from a mental health and/or substance misuse issue or crisis. And according to the National Policing Institute, communities that have a co-response model like the Mobile Crisis Response Team report a reduction of average time on calls from 185 minutes to 136 minutes, increases in individual engaging and available behavioral health services, reductions in psychiatric hospitalizations, and reductions in police use of force going from 12.1% to 4.2%. Just as we have a first responder system in place which is trained and responsible for safety, fire, and medical crisis, we now have an appropriate first response system to address psychiatric emergencies, substance misuse, and other behavioral health crises, and that's going to be done in partnership with our local police and EMS services. As we created the Mobile Crisis Response Team model, we felt strongly that it was important to connect these precious resources to local community efforts. The community leaders here with us today, our city officials, local police departments, and behavioral health agencies know their communities best, understand the unique strengths and challenges and needs within a community, and have existing relationships with the credible services and messengers such as schools, faith-based, health, and other community-based organizations. These connections are essential in creating safer communities and meeting the needs of children and adults experiencing a behavioral health crisis. The Mobile Crisis Response Team, as our county executive stated, will be located in 7 community sites and cover all police jurisdictions. All referrals to the Mobile Crisis Response Team will be through a 911 local PD response, and decisions will be made on the most appropriate response, whether it first involves securing the scene for safety, a co-response, or perhaps a sole behavioral health response. The mobile crisis teams will provide follow-up to ensure appropriate services and connections are made for the individual and/or family. Our department, the Department of Community Mental Health, will provide support, oversight, training with the mobile crisis response teams, including extensive evaluation component addressing the progress and effectiveness of this initiative. And I just want to turn our attention to many of our behavioral health mobile crisis teams in the back. We have the agencies that are represented, People USA, Family Services of Westchester, the Guidance Center, Mental Health Association, and Westchester Jewish Community Services. They are the experts, they are our co-partners, and we really appreciate all that you guys are doing. I'm proud to share this effort was made possible by a true partnership between county, local government, local police, and our behavioral health agencies, all with us here today. Let me be clear, Project Alliance and the Mobile Crisis Response Team would not have been possible without the efforts of our county and local Reimagining Police Task Force and our county efforts under chairs Mayor Bartlett and Mr. Frazier, who identified the need for crisis services. And of course, my colleagues at the Departments of Social Services, Public Safety, Emergency Services, and other key stakeholders. And of course, our own department under the leadership of Mark Giuliano and Chris John, who helped us get to this point and will lead us beyond. But most importantly, the leadership of our county executive, George Latimer. Under his direction, we were charged to research best practice models not only in New York State, but across the country, build on existing things that we know work in Westchester County, and supported our 5 recommendations under Project Alliance and made them become a reality. So what's very unique about this model, unlike pretty much anything that we've seen in the state or even country, is that we're providing a 911 dispatch diversion process where all the dispatchers are being trained or have been trained to receive behavioral health calls and assess using an evidence-based instrument to see what level of risk and, if appropriate, send it over to our new crisis network line at St. Vincent's Hospital. We already have over 80, 90 calls that have been redirected using that service and creating a more appropriate response. We also have increased crisis intervention training throughout Westchester County thanks to our public safety department. And we're also starting to do EMS training for those folks who go out often on these crisis situations and don't always have the training that really they should be provided with. And finally, it's the mobile crisis response team that is really going to enhance our efforts and provide a local behavioral response. We are confident that Project Alliance and the mobile crisis response team will help make our communities safer for our first responders, our residents, and individuals who experience a mental health crisis by providing the most appropriate response to keep them safe and ultimately save lives in Westchester County. Thank you.
Thank you. That was Commissioner Michael Orth, head of the Department of Community Mental Health. I would like to recognize we've been joined by Westchester County Legislator David Tubiolo. We've also been joined by Lieutenant Donahue from the Ossining PD and New Rochelle's Police Commissioner Gazzola. And so thank you all for taking time from your day to be with us here. Our next speaker is the Deputy Commissioner of our Department of Public Safety, Terrence Rayner. I think it's important to note the coordination and the cooperation between all these different offices of county government, as well as the coordination with local government. And when you see the community mental health, police, DSS, I know we have Office for Women here. I see Nancy Tunis is with us. So many different components just of county government alone are working in sync and in harmony. Commissioner Rayner.
Thank you, County Exec. Good afternoon, ladies and gentlemen. Especially hello to all my law enforcement colleagues that are here today. On behalf of the Department of Public Safety, I would like to thank the County Executive and all of the partners here for their great work in bringing the Mobile Crisis Response Teams model to fruition. This initiative will help all of us to best serve the persons with mental health issues who are in emotional crisis. The ability to have mental health professionals respond along with police officers or instead of police officers is a game changer. The initiative will ensure that mental health experts can begin to provide immediate care in the field when necessary. The mobile crisis response teams will ensure the safest possible outcome at the most highly charged incidents. Thanks to the Department of Community Mental Health, communications officers assigned to our dispatch center and dispatchers at the Department of Emergency Services have received enhanced specialized training to assess calls for service and direct the appropriate response. When a police response is not needed, those officers can continue their patrol functions and handle other calls for service. Westchester County police officers have also received enhanced training from mental health professionals in crisis intervention and de-escalation. Our goal, as always, is for every encounter to end safely, without incident, and to get an individual in crisis the help they need. The county police are committed to the success of Project Alliance, and we look forward to utilizing this new resource. This initiative will be an invaluable tool for the entire police community. In the past, when a police officer responded to a call for service and was met by an individual experiencing some sort of mental health crisis, the officer's response would be a call for more police. Generally speaking, officers do not have immediate access to mental health professionals who are better equipped to deal with those situations. That all changes today. Project Alliance will go a long way in making our county a better and safer place. We are looking forward to the success of Project Alliance as well as future collaborations with our government partners. Thank you.
Thank you, Terrence Rayner, Deputy Commissioner of our Department of Public Safety. Next comes our Commissioner of the Department of Social Services, Leonard Towns. Commissioner.
Thank you, George. Mental health has sometimes been an unrecognized factor in police interactions with communities. With the pandemic we're facing in society, this collaboration is more important now than ever. FSW's history of working in communities, particularly here in Port Chester, make them the ideal organization to participate in this initiative. Now, part of the mission of the Department of Social Services is to ensure the health, safety, and protection of vulnerable adults and children, and this initiative will achieve that. Through this partnership, working with the Department of Mental Health, local law enforcement, emergency services, and public safety, we should be able to successfully navigate situations that have been painfully hurting us in the past. We've known of situations where mental health situations are undiagnosed and has led to bad outcomes. But with this opportunity, with police being trained and with the support of a mental health agency behind them, we should be able to do great things here in Westchester County. In closing, I'd like to thank the task force for their commitment to bringing about change in this area. I want to thank County Executive George Latimer for his stamp of approval on this initiative. I want to thank all the partners, local law enforcement, emergency services, Richard Wishney, Commissioner Michael Orff, Mental Health, Deputy Commissioner Raynar at Public Safety for coming together along with the Department of Social Services to ensure the health, safety, and protection of all the citizens of Westchester County. Thank you.
On the grassroots line of police work are those who head our different municipal police departments. I believe there's about 40 altogether. And they have a difficult challenge. They take care of the streets of the communities that they represent, and they deal with whatever might happen day to day to day to day. The county has some of that responsibility where we're contracting in Mount Kisco and in Cortland. We police the parkways and our county-owned park facilities. But when you deal with a particular community and all of the different nuances in it, takes a lot of hard work, takes a lot of dedicated men and women. And on behalf of the many police departments that are represented today, I wanted our hometown police chief, Chief Rosabella, to share some of his thoughts as sort of the lead agent in all of this at the local level. Chief.
Good afternoon, everyone. There's not much I could say that hasn't been said already. I'd like to thank the county executive, commissioner, everyone that was involved with this. It started out as an idea. They saw it through to where we are today. Village of Port Chester Police Department, we're very excited to host this initiative. Everyone knows that we need it. We used them yesterday, I think, and they saw our first call through fruition and successful ending. The only other thing I wanted to say is that, as police officers, one of the most intense calls we could go on is a individual suffering from a mental health crisis. And although we're well-trained, police officers, we are well-trained in handling these types of calls. We're not experts. And now we have the availability of experts to call on and to help and to partner with us. So we're excited, and we are committed to this program, and we're committed to making it successful. Thank you very much.
Our next speaker is Karen Fink, who's the Vice President of Clinical Services for Family Services of Westchester. And we have to recognize that the nonprofit partners in this provide tremendous expertise and skills. And so on behalf of all of them, Karen, we appreciate you being here and the work that your organization does.
Thank you. So I'd like to thank the County Executive, George Latimer, and the Department of Community Mental Health, Michael Orff, and his amazing team for really having the vision and the dedication to getting this initiative off the ground. It's really an important initiative for all of our communities. I also really want to thank the police departments. It's great to be here in Port Chester. I worked here for many years in Port Chester, and how welcoming the police departments have been in having us work alongside. We feel really strongly that social workers and peers, people with lived experience, these teams being first responders for people who are experiencing mental health crises, substance issues. We are skilled to be able to provide these services. We think there will be better outcomes, safer outcomes, and which will lead to safer communities. So we are really excited, Family Services of Westchester and the other agencies, to be partnering in this amazing initiative. Thank you.
I just want to recognize we've been joined by our relatively new Deputy Commissioner of Planning Department, a Portchester resident, and she serves in our executive team in other capacities. She's also going to be serving as our representative on the MTA board, as recently has been approved by the State Senate. Blanca Lopez. I previously introduced them, but I'd like the 4 county legislators to please stand and remain standing. Damon Marr, David Tubiolo, Vidat Gashi, and Nancy Barr. There is nothing that happens in this government that does not happen without a cooperative effort between the legislative branch and the executive branch. As county executive for the last 5 years, but for 30 years prior to that as a legislator myself, I understand the important relationship between the two bodies. There are times we disagree, sometimes intensely, but at the end of the day, every success is owned by legislators as well as executive implementers. So I think we owe a round of applause to our Board of Legislators for their role that they play. I don't know if we expect to have press questions. I'll ask my team. We do? Okay. Then we'll go to any questions from the press that would like to direct it. We know here in Portchester we have Westmore News and other media outlets, so please, by all means, any questions for myself or any other member of the panel, we're happy to take them. And if there are no questions now, then certainly through the feed, they're welcome to call our communications department, 995-2932. And if they want to talk to some of the other individuals who are not connected directly to our executive branch, we'll connect them so that they can follow up for any of the publications that are out there. I'll just make a couple of moments of closing comments, and then we'll be on our way. Again, let me thank those people who've come from a distance, the chief elected officers, Mayor McKenzie, Mayor Pickenich, Supervisor Levenberg for being here today, the New Rochelle Police Commissioner and the chiefs and senior managers of the various other police departments. They went out of their way to be here just to show how important this is in its launch. And we put weight and value to that. Other elected officials who are here, Councilwoman Jackson, Councilwoman Hendricks, and of course here from Portchester, the mayor and Trustee Grenoir Thomas. I opened and I'm going to close with the same basic point. We have seen some major tragedies happen in our society. What happened 2 years ago in Minneapolis was a tragedy, and also what happened over the last few days in Texas and a week ago in Buffalo was a tragedy. Those of us in elective office can choose to respond to those tragedies in different ways. The most common way is to make a statement, and I made a statement, and most of us are expected to say something on the topic. If you follow what we say, most of it can be pretty redundant because there's only so many different ways, and there's many more people to say it. The governor of this state and the mayor of that city and county executives and all the way up and down the line. But the question isn't how articulate we are at the moment of tragedy. The question isn't can we symbolize the way people feel in their anger and their fear, but what can we do constructively to deal with the issues thereafter? You've heard some of the comments after this tragedy relating to mental illness. Some relate to gun control. They're all across the board. But what we're talking about today is a response 2 years in the making, and it takes that long to put something together that has rooting in reality, not just a press conference and you say something. The professionals who police the streets of our city have to know that whatever it is that gets constructed by the politicians can actually work. And the people who are the mental health professionals have to know that what gets constructed can actually work. And we have to be able to fund it, and we have to be able to staff it, and we have to be able to implement it and then monitor that implementation so that it achieves the results that they want. But we may not ever know if we're successful. It's the thing that doesn't happen, that could have happened because of the work being done, that will be seen as the success of this program. When nothing happens in Peekskill where something might have happened, when nothing happens in Ossining or Mount Kisco or New Rochelle or Greenberg that might have happened, we won't know it. What we will know is that these people who we trust, we fund, and we believe in are trying to do their job well, and they're willing to accept changes. This is a major change in the way we respond. This is not business as usual. And this is something that we can all be proud of, because we as Americans, forget our positions of authority, we as Americans the crisis, and we're responding to it. Indeed, not just in word. I'm George Latimer, Westchester County Executive. Thank you for being a participant here. And for those who are in the room, as soon as we complete the press conference, I'm sure you'll want to chat with some of these fine men and women, get to know them a little bit better in their work ahead. So thank you very much. Have a good and safe day.